Hi, good day or good evening to you. How are you? I hope that you are all in good hands and enjoying whatever you are doing at this very moment. Okay, as you have observed that COVID-19 cases are going down, but still the novel disease continue to affect persons with comorbidities or with chronic illnesses, patients who are also immunocompromised and immunosuppressed. Likewise, people with extreme of ages, like the old and the young. Almost every nation all over the world are already in the process of vaccinating people in their respective community or domain. I also noticed that younger population or children nowadays had an increase or frequent visits in the doctor's clinic or in the hospital's emergency department, especially during these rainy and cold months. Many kids had common colds-like or flu-like symptoms, and it is really very hard to identify or differentiate it with COVID-19 base from the clinical symptoms alone. Not unless if you as a physician will request an RT, PCR or COVID rapid antigen swab test or exam. But in my real world experience, few patients will comply due to the fact that the COVID swab test is expensive and invasively painful. While other parents are also reluctant and refuse to undergo self-quarantine or isolation in case the test turns out to be positive for SARS-CoV-2. Naturally, it will result to a big financial loss to the family involved. And for me, one of the best solution as of the present time is prevention. We all know that prevention, an ounce of prevention is better than a pound of cure. The best solution for that is by vaccination, such as an influenza vaccination can be taken before the year ends. So meaning it should be taken annually, and then your pneumococcal vaccine for prevention for bacterial pneumonia can be taken every 5 years. And the most important of all, as of the very moment, is getting a COVID vaccine shot for your children. But the only EUA approved vaccine is Pfizer-BioNTech for children or persons aged 12 to 18 years. I know that few of us don't know yet the vaccine's effectiveness in that type of population in children. So let me show to you a study from the Centers for Disease Control and Prevention in the US during their morbidity and mortality weekly report, which was presented October 19, 2021. This is now the study that I want to present to you. The title of the study is Effectiveness of Pfizer-BioNTech mRNA Vaccination Against COVID-19 Hospitalization Among Persons aged 12 to 18 years in the United States, starting from June 1 to September 30, 2021. Okay, so it involves 19 pediatric hospitals in the 16 states in the US. This is a case control study. Okay. So the study involves 464 participants, of which 179 case patients on this side with COVID-19 symptoms and with positive RT-PCR test result. On the other side, this corner, 285 controls with no COVID symptoms and with negative RT-PCR test result. Of these 179 case patients who are admitted in the hospitals, 6 patients complete their vaccination requirement. So they received 2 doses of Pfizer-BioNTech vaccines for children. On the other, here in this arm, 173 patients are not vaccinated, so they don't have Pfizer vaccine yet. And of the 179 case patients admitted in the hospital, 77 of them were admitted in the ICU or intensive care units. And to note, out of the 77 patients admitted in the ICU, 29 patients were critically ill and attached on mechanical ventilation or volume respirator. They also received ECMO or extracorporeal membrane oxygenation and were given vasoactive infusions in order to survive. But despite of the aggressive medical interventions in the ICU, 2 patients died in the ICU with critical COVID symptoms. Now, of the 6 patients who are admitted in the hospital with complete vaccination, they are all discharged, improved, with shorter hospital day stay, with less COVID symptoms. And it was also found out that unvaccinated patients, pediatric patients, had a longer hospital stay with increased disease severity and death. And based from these study results, the vaccine effectiveness of 2 doses of Pfizer-BioNTech vaccine against COVID-19 hospitalization among children and adolescents 12 to 18 years is 93% to 100% efficacy rate or effectiveness. Pfizer-BioNTech vaccine is so effective against COVID-19 hospitalization among children and adolescents aged 12 to 18 years. Likewise, this data that it also suggests that increasing vaccinations among children aged 12 to 18 years can reduce or decrease and even prevent disease severity, mortality, or death due to COVID in our area. Once again, this is Dr. Amihan, your humble servant in health in the northern part of Antique, wishing you the best of everything. God bless and thank you for watching.